Hello, I'm Seth Clement. This is my business binder, and I will be doing the report of findings today.
I'm Nick Lewis, and this is my business binder, and I will be doing the office policy and the financial report.
Hello, Nick. It's great to see you back in the office. So I know last time we saw you, we did some different tests, and we took some X-rays to find out exactly what's going on. Well, Nick, I know you've been dealing with a lot of migraine headaches, a lot of neck pain and things like that. So that's why we did a lot of the tests to see, if we could find anything that would be causing that. Okay. So if you look right here, we did some palpation, and we did find some tenderness and some spots that were probably what we call subluxation. I know I explained that a little bit to you when we were going over that. We'll get into that a little bit more. But Nick, when we did some range of motions, different things like that, and then we actually found that when you lift you take your head towards the side of your shoulder, that you're actually only going 30 degrees, and you should be going about 45. And when you go to that side, you're going about 45. So there's definitely cause for subluxation. Now, Nick, before we go any further, I kind of want to explain what subluxation is and exactly what we were looking for when we took the X-rays and when we did the tests. So we know that everything, your brain controls everything. So for your heart to beat, your lungs to breathe, they have to receive messages down your spinal cord, out your nerves. That's the way our body functions and heals. But Nick, what we found is that if you put a pressure as little as like almost a dime or less than a dime, which you put that in your pocket, you wouldn't even feel. What that does is that actually interferes with the signals coming from your brain out to your, all your organs. So Nick, not only is it just, that you've been dealing with some headaches and neck pain, which, from the x-rays definitely could be coming from that, that subluxation, that can be leading to a lot of other major organs in your body. So Nick, and the thing is, as soon as you have that subluxation, it starts affecting your body in an adverse way. And so if you look right here, it can change the way your muscles are, so you can get muscle spasms or weak muscles. So that's kind of why I know you've been having a lot of tight, tender muscles on this side, and you've been noticing that, some fatigue in your hands and your arms quicker than you used to. It definitely could be coming from what there. And then not only does it have that muscle, but once you start stressing that can lead into actual changes in the tissues in your body. So Nick, if you look right here, we have kind of 3 stages, and you can tell how there's a lot of damage right here, and then this is a pretty normal or close to normal. What we found is that you're somewhere right in here, right in between stage 1 or phase 1 and phase 2. But Nick, even more importantly than the damage to those, the muscles and the tissue surrounding your spine, if you look right here on your x-rays, once you start having those subluxations, that can lead to degeneration in the spine. And what we found is there's really about what we call 4 phases. And Nick, you can tell just by looking at them, how this looks nice and healthy and this is starting to degenerate. What we found is that you're almost to a stage 2 or just about at a stage 2. So now, Nick, what that means is, how we talked yesterday before we took the x-rays about how your curve in your neck should be about 45 degrees. You're at actually about 11 degrees. So that's almost an 80% loss in your curve. And so what that's doing is that's putting a lot of that tension on those muscles and putting pressure, a lot more than just a pressure of a dime, on those nerves that are causing a lot of those headaches and those migraines. So Nick, in order to, we can do an adjustment to get you, to remove some of that pain. But the thing is, what we need to fix is we need to fix and start putting that curve back in that neck. And we need to start doing specific adjustments to actually start, stop that degeneration and actually start getting some correction in that curve. And that'll allow your body to function and heal. Okay. So what we need, Nick, is usually, it's been there for a while. You've been having migraine headaches since you're about 10. So there's been damage, and a phase 2 has been there. It means it's been there for a while, so it's starting to build up. So it's going to take you it's going to take some time to actually get that correction. So what we want to do is we want to set you up on a 36 visit care plan, so that we can try to see exactly what's going on. So what we do is we'll do 3 times a week for 36 weeks, so that's 36 visits at 3 times a week would be about 3 months.
Mm-hmm.
And at the end, we'll have another doctor come in. He'll explain exactly how we're going to financially, work that out for you. But then at the end of that, we'll take some more X-rays and do some more tests and see what's going on and see what kind of correction we've had. Okay?
Mm-hmm.
Sound good?
Yep.
All right, we'll send the other doctor in.
Okay, thank you. Hi, I'm Nick Lewis. I'm the doctor going over the report of the financial report with you and the office policies. Now with office policies, we're open 8 to noon, 3 to 6, about 5 days a week from Monday through Friday, and our lunchtime is from 12 to 3. But what we try to do, we try to keep the existing patients in the office from 8 to 10:30, and then that way we have from 10:30 to noon to get new patients, exams. You just went through the exam, it takes a little bit longer than a regular just adjustment. And then when we open back up from 3 to 6, we try to keep the new patients later. So we would have you come in anywhere from 3 to about 5, and then from 5 to 6 would be for new patients. It's just a block schedule, keeps the office running smoothly, and that's what we try to maintain. And then we're also open Saturdays from 8 to noon, and that's anybody can schedule Saturdays. If that's the only time you can come in, that's fine. We try to keep new patients in with the existing patients on Saturday mornings. And then we also have, we call them appointment rules. What we do is, we would like, if you're going to miss an appointment for an emergency, that's fine. We understand emergencies happen. We would need you to give us a 24-hour advance call, though, to make sure that we can set your appointment time in for a new patient or in for an existing patient that needs to come in. So if you could just give us a call in advance, that'd be great. And what we do is we do a 3-strike you're out rule, kind of like baseball. Okay. What we do is if you miss once, that's fine. Like we understand things happen. You miss twice, that's still okay. But the third time, we're going to have a meeting in the office, and what we'll do is we'll either decide if you're going to be able to make the existing appointments, or if we need to find a doctor that might be closer to you, that might have different hours that you could make. Okay. Or we'll try to help you out there. But we would really appreciate you coming in on your scheduled appointments. One, for your benefit, to get the rehab and to get to get your spine working correctly, and then 2, for us, so that we have, we know when people are coming in our times. And then we also have a spinal class, a spinal hygiene education class. Now we would like it to be mandatory for you. Like we want you to come every class. And what it is, it's about an hour class. We teach you how to do stretches, how to properly stand, sit, all that stuff, and it's just a little bit more info for you about chiropractic education. Now, if you bring a guest in and they decide to stay or they decide to become a patient, what you would receive is 1, you get the class for free. 2, you get a free dinner that night, and then 3, if the guest decides to stay and become a patient, they will get their first set of X-rays at a discounted price, and then you would also get a free service, either a free nutritional counseling or free like spinal aid or something like that. Okay. And then for the financial part, we accept insurance and we also accept cash. Okay. So for the insurance sets our payments. So it's $52 per adjustment, and if you pay, or it's $40 for a cash adjustment. Mm-hmm. Now we also offer a 3-month plan. If you sign up for 3 months, we have found that a lot of people keep their appointments more. You get the benefits quicker, okay. And if you pay cash, we give it to you at a discounted price. So if you're an insurance patient, we have to keep that same price. It's just $1,872 for the 3 months. Okay. You get it out. You get the payment out of the way. You can just walk in, sign in. When you leave, you just make your appointment and you leave. You don't have to bring cash with you in case you forget it. And for the discounted cash plan, we take 10% off each adjustment. So it's $1,246 okay. for the 3 months. So if you would like to do that, we can sign you up today. Yeah. And
sounds great.
Yeah, it'd be a pleasure doing business with you.
Thank you.